This morning, that cruise ship hit by Hantavirus, now just 24 hours away from arriving here in the Canary Islands. The World Health Organization has now confirmed a sixth case of the virus, but President Trump and other officials are still urging calm.
We seem to have things under very good control. They know that virus very well. It's been around a long time, not easily transferable, unlike COVID.
Echoing the president's comments, the CDC said the risk to the public remains extremely low and has deployed a team to the Canary Islands to meet the Americans trapped on this luxury cruise ship when it anchors on Sunday. Spanish authorities preparing to receive the ship amid mounting protests from locals angry about the risk of an outbreak.
The ship is now hours away, and people here are angry. They're shouting things like, yes to tourism, no to the virus.
Among those on board, 17 Americans who'll be flown home on a repatriation flight arranged by the U.S. State Department. They'll isolate in the National Quarantine Unit at Nebraska Medicine in Omaha, the same facility that housed people exposed to COVID in 2020 and Ebola in 2014.
They will, on arrival, receive an epidemiologic assessment, and at that point, the quarantine period will be determined. But at this point, we don't have a defined quarantine period.
As officials around the world race to contain the spread of the deadly Hantavirus, New Jersey now monitoring 2 people not on the ship, but potentially exposed to an infected passenger during air travel.
Now, Spanish authorities say small boats will ferry about 5 passengers at a time. They'll be brought here to the port, isolated from the public. They'll then head straight to the airport, board their repatriation flights. Local officials say it could take up to 48 hours. Emily, back to you.
Danielle Hamamdijian in the Canary Islands. Thanks so much.
For more on all this, let's bring in Dr. Akshay Syal, an NBC News medical contributor and reporter. Dr. Syal, so nice to have you this morning. Let's pick up where Danielle left off. Obviously, there's the logistics of all of this will be quite important. What's the first thing medical experts have to do?
So, Laura, good morning. This ship is expected to reach the Canary Islands tomorrow, the island of Tenerife. And what happens now is, we have to make sure that these people remain asymptomatic. So they're going to be met with global health officials from various countries. A team from the CDC, as you just heard, is going to be meeting them. And, what they are telling us so far is that all of these 17 Americans do not have symptoms at this time. They are in good health, fortunately, no symptoms at all. They're going to be taken from these islands to Nebraska. A plane is going to take them to Nebraska, where they're going to be in a sort of quarantine unit. They're going to be monitored, and here's the key part, we don't know for how long. This virus has a bit of an incubation period, meaning from the time you're exposed to something, from the time you actually develop symptoms, can be several weeks. So we'll have to wait to see how long officials want to keep an eye on them over there.
So we've heard a lot about the precautions in place, but what about the passengers who already left the ship and went back home? Has enough been done in those cases?
So, Emily, it goes back to that incubation period, right? It takes several weeks to know if you're exposed to whether or not you have symptoms. So we know there's several states in the U.S. that actually have passengers who are potentially exposed on that cruise ship. Arizona, California, Georgia are some of the states that we've heard so far. And, there's no isolation for these patients yet. We sort of have to keep an eye on them. They're going about their day-to-day life, sort of keeping an eye on symptoms like fever, body aches, chills, really non-specific symptoms that we're just watching for, but they are not being told to monitor or not being told to isolate at home.
Doctor, for so many people, this entire thing has had flashbacks of COVID. So many people are saying, are we headed for another pandemic? This is not like COVID, to be clear.
This is not like COVID. Public health officials from the WHO, from the CDC are very stressful that this is not another COVID-19 pandemic. A couple things to note, guys. This virus is not as easily spread as COVID-19. It is not a mutated virus. It is very close to the Andes virus that we already know. So for everybody out there watching, the key takeaway is you do not need to worry about this, especially with the holiday weekend coming up. Please do not cancel your travel plans. Keep on going life as usual, guys.
Good news to hear. Doctor, appreciate your time.
Thank you so much.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.